I'm David Cella. I'm a professor of medical social sciences at Northwestern University's Feinberg School of Medicine and associate director of the Robert H. Lurie Comprehensive Cancer Center at Northwestern. So to summarize the results of this presentation, uh, previously we had reported that the nivolumab-ipilimumab combination, when compared to sunitinib in advanced renal cell cancer, improved overall survival and progression-free survival, and also improved quality of life. This particular study looked more closely at that relationship between patient-reported quality of life and clinical outcomes such as progression-free survival and overall survival, and found that both the baseline, that is pre-treatment reports from patients, and the longitudinal post-treatment reports from patients over time were significantly predictive of both progression-free survival and overall survival. And this raises further questions about how we might be able to understand the benefit of asking patients how they feel and using that information to help guide clinical decision making during the course of treatment for advanced renal cell cancer. Well, the Fixie 19 questionnaire asks a series of symptoms and side effects associated with kidney cancer treatment. It also asks people about how they feel generally about their quality of life and their ability to engage in their usual daily activities. So things other than cancer can, of course, influence the way people respond to these questions. Your mood, your social situation, and your general approach or views on life can also have that influence. Well, I think the best way for Fixie scores or Fixie responses to be used in clinical decision making is for the clinicians that are taking care of patients to get familiar with the questions and what the scores mean when summing them up into their standard score totals, but also question by question, what might be a threshold for discussion with patients. In other words, the Fixie questionnaire can help to begin the conversation on the emergence of a new symptom or a problem a patient might be having as he or she goes through the course of treatment. Well, the next step in using Fixie 19 scores in practice is to get clinicians and patients comfortable with the realization that what patients have to say about how they feel and how they're functioning is very important and useful for making clinical decisions along the way. Here at Northwestern, we're doing this in a standard way, using questions up front to get the conversation started about symptoms such as fatigue and pain and depression, etc., so that we can intervene early, and capitalizing on many studies that have shown now that active monitoring of symptoms in clinical oncology practice does improve symptom management and quality of life, and in some cases even helps extend survival.